You're watching a special edition of the Wellness Hour, the most watched medical television program in the world. I'm Randy Alvarez. My first guest is Dr. Bruce Landon. Dr. Landon is a board-certified plastic surgeon. He has joined the team at the Cosmetic Surgery Institute in Palm Desert. We've invited him on the program today to discuss what you need to know if you are considering breast surgery. Dr. Landon, welcome to the program.
Thank you very much for having me, Randy.
Now, before we get into today's topic, breast augmentation, lifting, things like that, let's talk about your background. Brand new from Florida. Where in Florida?
Tampa.
Tampa. Okay, what brings you here to the desert?
It's coming home, Randy. I did all of my training out here in Southern California, spent the last 12 years out in Florida, and for just ready to come home to Southern California.
So where'd you go to school?
I went to school, medical school at UCLA, and did both general surgery and plastic surgery in San Diego.
Okay, and you became a board-certified plastic surgeon, also in general surgery at one time?
Also in general surgery, yes.
Okay, now the CSI in this town, and you're brand new out here, but pretty much everybody knows Dr. Ball's office, Dr. Mo Zachary, who's the other young plastic surgeon in this town. What was your first impression when you get there, and how'd you hook up with those guys?
You know, I consider myself pretty privileged, Randy, to have been asked to come and interview with their practice. They've been looking for an associate for some time, and I was out looking in the Orange County and LA area and got wind of the practice looking for a new associate, and they were kind enough to ask me to come down for an interview. And it's of all the practices that I looked at in the Southern California area, really a very cohesive group of individuals. Dr. Ball, Dr. Zachary, wonderful individuals, and hard to find in our field.
Behind your back, they said, this guy does great work. Have you seen his pictures? Wait till you see his pictures. So do you consider yourself an artist? We always use that on the show, artist. I think sometimes it's overused, but do you see yourself that way?
I think that I have an artistic talent with a knife.
Okay.
I'm not so sure that my artistic talents transcend to a pencil and a paintbrush.
Okay, but but how much art, how much science in general? And I know as a plastic surgeon, I guess you do everything. Is that right?
Yeah. I think it's a blending of the two, Randy. It has to be. One has to have an eye for what conceptually is good looking or beautiful, if you want to use that term, and if you don't have that eye, then how can you go about reconstructing, molding, or shaping something to take it to somewhere where you don't know where you should be?
All right.
So I think it takes some artistic talent.
Okay, trends in breast surgery. Moving right in. What's changed? What's changing? Is it the same? Anything changing?
I think that the one big dynamic that's changing, Randy, is the re-emergence on the market of silicone breast implant products. Since 1991, when the moratorium on silicone implants took place, the lion's share of enhancements or breast enhancements been with saline products. Now we're seeing a shift back with the conditional approval of silicone products of more silicone enhancements.
So you believe they're safe?
I do believe they're safe. I don't have any medical concerns regarding that product.
Now, I've had them on the program before, and they say, Randy, you feel them, and you be the judge. And silicone really, to me, the main benefit is one feels like flesh. It's very natural.
Right.
But what are the other benefits?
It's a soft feel, Randy, and when it comes to comparing a saline product to a silicone product, you put it in the hand of a prospective patient, they're going to pick the silicone product every time. It does have a more soft, natural feel. In the event that somebody has a very limited amount of breast tissue, it's a more easily concealed product. Okay. Saline products, I really don't believe, and I think this is a critical component to a critical issue for people to understand, Randy, is that there really is no difference in the look that one can achieve between a silicone and a saline product. It's a feel.
Just a feel.
It's a feel issue.
A feel.
It's a feel issue. Some people are still, and will always have those individuals that are fairly phobic about the silicone product and the bad press that it had once upon a time. And the other change, Randy, is that we're seeing a pendulum swing. 5 years ago, we saw patients coming in and asking for the biggest implant that they could conceivably accommodate. Now we're looking at individuals adopting a little bit more of a conservative tack. That slightly less large, more shapely look is becoming more vogue.
Okay. Now, how do you determine size, by the way, in your practice with you?
Well, there's a number of different ways to do it. And I think everybody adopts their own style, Randy. I mean, in Florida, I had two things in the practice. One of the things is allowing individuals to wear a sizing bra, putting in a variety of different implant sizes, and getting a sense of what they look like with clothing on.
Okay, how accurate is that? I've never seen the process done, but it doesn't seem like it's very accurate.
You know, it's fairly accurate for a silicone product. It's very inaccurate for a saline product.
Interesting.
So in my practice, where we did a lot of saline in Florida, where we had a very silicone-phobic market, then I took it a step further. What I asked my patients to do was to give me a visual idea of what they considered ideal. So I would show them a host of before and after pictures and ask them to show me what they find visually attractive.
Okay.
Because we can talk all day long about, I want to be a B, I want to be a C, I want to be a D cup, but my definition of a C cup and their definition of a C cup could be miles apart.
Okay.
And it's my job, at least I look at it as my job, to get them as close to what their desire for outcome is going to be. But if they show me a visual endpoint, then I know where they're starting, Randy, I know what the implants can do, and then they've given me something to achieve.
Now, what age are the patients that you're seeing?
They're 18 through their 60s.
60s?
Believe it or not.
Okay, a lot of lifting there. Now, I have a lot of questions about breast lifting, but incisions. It seems that there's a lot of disagreement or a lot of different views about incisions. Let's start there. Where do you place your incisions?
No, there's a number of different ways to place the incision, Randy, and I think that the two most popular are through the nipple complex, which if one looks at the nipple like the face of a clock, their incision is made from about the 3 to the 9 o'clock position. That gives us access that we need to place the implant. The other common method of entry is using an area underneath the breast. So in that natural crease underneath the breast provides a very ready access for implant placement. The other two, a little less commonly used methods of placement would be through the armpit or even through the belly button.
So what do you do? What's the best?
Through the nipple,
for the basic augmentation.
Through the nipple complex or underneath the breast have very reliable and predictable outcome. The other two methods, although we mentioned them, have a much higher degree of unpredictability and unreliability.
Well, which one do you like the most? You say under the breast or through the nipple. Which one do you like?
You know, I think those two are 50-50. The only thing that sways my decision-making process one way or another is a very small nipple complex and a sizable implant don't mix.
Okay.
In other words, it doesn't give us enough access to put the implant in. And
but logically to me, why touch the nipple when you could go underneath?
Look, this is one of the focused points of my consultation. I tell, look, no matter how well that incision around the nipple heals, you're always going to be looking at some type of a scar.
Okay.
But
it's small.
It's small. It's very small, and some people find it very acceptable because it's in that transition area.
But as a surgeon, why do you like doing it that way? I mean, is there an advantage?
I don't think that there's so much of an advantage, Randy. As a matter of fact, I think that there are slightly increased disadvantage to use the nipple complex.
Okay.
In a younger female, it violates some of the ductal tissue, so it could compromise their ability to breastfeed, although it's not widely considered to be a huge problem. It also causes a little bit more change in nipple sensitivity.
Okay.
So if I had my choice and someone said, look, doctor, put it in the area that you feel the most comfortable and you think is going to give me the nicest aesthetic result.
In the fold.
Underneath in the fold is, hands down, in my opinion, probably one of the nicest, most accommodating areas for
What about belly
placement.
button? Kind of gimmicky?
You know, it has its proponents. It's gotten a little bit of bad press lately with a few bad complications that have occurred.
I didn't know that.
But it didn't widely catch on, and the reason that it didn't widely catch on, Randy, not very many people kind of know this, but up until a few years ago, both implant manufacturers voided the warranty on your product by placing it through the belly button because of the way the implant needed to be folded into this introducer to get from the belly button onto the breast area.
Okay. With the breast augmentation procedure, seems pretty straightforward. And I've talked to Mo Zachary about this. It seems like the technique, that pretty much you put the implant in and what happens, happens. How much is technique?
I think it's a lot of technique. I mean,
with the outcome and how they're going to look.
At the end of the day, the goal is to get the implant symmetrically in the breast mound so that there's some harmony between the breast tissue and the implant. And there's some delay in, of course, that harmony occurring, and that's why there's that period of maturity that has to take place.
What does that mean? What do you mean?
It means that there is some length of time, Randy, between when I tell somebody what you see is what you get, And depending upon what they present with, that can be anywhere upwards of 2 to 3 months before the implant and the breast tissue kind of both know that they're in the same neighborhood.
Now, I was told one of the busiest breast guys in Florida. Is that true?
Pretty busy. I'd say that we probably had one of the busiest aesthetic practices for breast enhancement.
You think you're good at it?
I think I'm pretty good at it.
Okay. Now, what about over the muscle, under the muscle? I mean, is everybody going under the muscle?
There are some very good indications for going over the muscle, Randy, but by and large, under the muscle is preferable for 3 main reasons. It softens the look of the enhancement. Most notably, it softens the transition from the upper chest out onto the breast mound by putting that muscle in between the implant and the outside world. It keeps the breast perkier for longer. It doesn't allow the implant and gravity to take as much of a toll on it as quickly. And thirdly, it decreases the incidence of hardness occurring around the breast. So for those 3 reasons, and those are the 3 reasons that I give to all prospective patients, that this is what causes you a little bit of grief and a little bit of postoperative discomfort, but we want you, and I want you to be as happy with this enhancement 5 years from now as you are 5 months from now.
Okay.
And putting it under the muscle really gives a little bit more longevity to the enhancement.
Moving on to breast lifting. What are the different categories of patients you see?
Well, breast lifting is done, Randy, when the breast has enough extra skin and enough droop to not be able to accommodate straightforward placement of an implant and allow the breast to drape the way it's supposed to over that newly placed implant. It implies that there's too much skin, too much sagging of the breast to allow those relatively more simple, straightforward enhancement procedures to be effective. And what we're confronted with is having to take their native breast tissue, lift it back up with or without an implant, and put it back into a more anatomically normal position for the patient.
Okay.
And that can be somebody that's post-pregnancy, because one of the most common things that happens after pregnancy is this loss of breast volume and breast tissue, that empty or hollowed out phenomenon.
Is it going to happen to everyone? I mean,
No.
over time, doesn't everyone need a breast lift?
They do.
In your...
Yeah. Look, small breasts are a curse and a blessing. They're a blessing in the sense that gravity and time take less of a toll on a small breast. The larger breasted patient will experience more gravitational descent of the breast tissue. They'll experience a little bit more loss of the volume, and they're the ones that are at more risk for needing a breast lift
it's fatty
procedure.
tissue, right? So no matter what you do, exercise, they're going to drop.
Exercise has absolutely no role to play in stalling or in reversing the sagging breast, because as you mentioned, it goes from a young woman who has a preponderance of glandular tissue to older women who lose those glandular elements and it becomes primarily fatty. And as it becomes fatty, it intrinsically loses support. And so it begins to fall and it begins to age. And their primary concern is what exactly is a breast lift, and what am I looking at in the way of scarring?
Right, that's what I hear.
In order to accomplish this.
They're
lift.
afraid of the scars.
Yeah, and so that sets off a whole consultation with what we have in the arsenal for breast lifting. Unfortunately, breast lifting hasn't changed appreciably in 50 years.
Okay.
And so what we're doing at the end of the day, Randy, is we're using and modifying the skin envelope of the breast to be the vehicle for lift. Now, where's the flaw in that argument? The flaw is that it's the skin envelope that let us down to begin with. It's the skin that's stretched out to allow the breast that used to be up here to now be down here. However, there's no supportive elements within the breast that allows us to do a breast lift from the inside out.
So what is the answer?
So we're left with confronting and managing the lifted breast from the outside in. What options patients have are, what kind of a lift do I need? And for modest types of lifts, we can accomplish some lifts just by placing incisions around the nipple complex themselves. Some individuals that have a little bit more droop have to take it a step further. The incision can be around the nipple and then a vertical component, so from the bottom of the nipple heading towards the crease. And for those individuals that have a long way to go in moving the tissue from down here to up here, they need yet a third component, which is the incision around the nipple, the vertical line to the crease, and then a crease component. So it's critically important that the lift be tailored to what they bring to the table. It's not one size fits all.
So their fears, though, are they don't want ugly breasts after this is done.
Yeah.
Are you convinced that no matter what, it's going to look better than what they had before? Is that your opinion?
I think it is my, they have to get out the risk-benefit balance, Randy. I mean, it's as difficult as it sounds. I mean, they've got two options. They can keep what they have, or this is currently what we have in the arsenal in 2008 to get them back to where they'd like to be. And unfortunately, to get them back to where they want to be involves some manipulation, some absolute visible changes to the breast mound that some people are absolutely willing to accept to get them back to where they want to go, and for some people, it's not okay.
So the breast lift patients, is this a happy group of patients? I mean, is this something they call you and they complain about these incisions are driving me crazy, or are they happy?
These are happy patients. I mean, a breast lift allows somebody who has very low self-esteem with regards to their unclothed breast and puts them back into clothing that they've never been wearing. They puts them into bras that they've never been able to wear. You know, the patient that's experiencing a lot of breastosis or drooping of the breast with that loss of support is compelled to wear certain types of clothing, and they have to wear certain types of very supportive bras to get them the shape that they want to have. And if you can provide them with that shape such that it opens up a whole new avenue of bra wear that may be a little bit less supportive, and tops and bathing suits and everything, we can take it a step further, Randy, and you know, it opens up a whole new arena for these people with regards to clothing wear, bathing suit wear, certain types of tops, things that they've naturally gravitated away from.
Yeah.
So, you know, that's what makes people happy. You know, am I comfortable with my new look, and does it open up, you know, a whole new avenue of clothing that I've not been able to look at the last few years?
Now, for those that are married, is it common they come in with their significant other?
I prefer that they do, and the only reason that I say it, Randy, is because of the external scars and the signs of management that it takes to lift a breast. I think it's critically important that their mate, that their husband or spouse be a part of the consultation process.
All right.
Because I don't think that a lot of people, because they've got information overload, can effectively take what I've told them home and say, honey, this is how they're going to lift my breast.
Do you wish you could say scars are not something you need to worry about?
I think that to a degree nowadays that we almost can. I think because all scars, in the event that they don't heal to people's level of satisfaction, can be managed in some degree. Number one, they can be, if you want to take it to the nth degree, they can be cut out and reclosed. We've got lasers, we've got topical skincare products that do a very effective job at getting the redness out of scars, that allows them to mature more quickly and blend into the background breast skin. If people can see far enough into the future, Randy, and that's one of the things that we show them with our portfolio, is look, we know you're going to have to look at something that looks immature for a while, but take this out 1.5 to 2 years. This scar is going to just blend in with the background skin and be an absolutely unnoticeable entity.
You said earlier, 50 and 60, and a lot of the women that are watching this program are 45 plus women.
Yeah.
The 50 and 60 crowd, you said it, that are getting breast surgery, is it usually the lift and augmentation combination?
For
the first timers.
For the first timers. You know what? There's obviously those people, Randy, that are fortunate enough to have breasts that don't need lifted and they're well into their 50s, 60s, and 70s. For those individuals that have, by virtue of the fact that they've had multiple children, by virtue of the fact that they haven't aged as nicely as they want, then the lift, either with or without an enhancement, becomes their procedure of choice. Look, face it, 50, 60, 70 nowadays is so different than what we experienced as children. I mean, these people are much more vital. They're spending, you know, they're wearing clothes that are more provocative.
Well, because breast augmentation, I guess, 30 years ago was not mainstream.
Absolutely not. It was closet surgery.
So for those people that put it off and now they're in their 50s, what do you say to them?
I'd say that, at least...
If they're not happy with their breast, obviously, do something about it.
Look, at least... coming to the consultation is not a rite of passage to surgery. It's a way for you to get every piece of information you need to make an educated decision about whether this is right for me.
Okay.
There's a lot of people out there that feel like, look, it's game over. I've had I've had 2 or 3 kids, I've lost the volume, my breasts are saggy, I can't, and that's just absolutely not true. We have so many things in the arsenal to rejuvenate that breast the same way that we can rejuvenate a face.
And when you say arsenal, you're referring to?
Surgical management.
Techniques.
Surgical techniques. We have so many things that we can do to provide that patient with something that they thought was irretrievable.
We're going to take a quick break, and I have questions about people that their breasts are starting to get hard and what you can do. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with board-certified plastic surgeon, Dr. Landon. Okay, breast redos. Tell us the different categories of these redo patients that are coming to see you.
Redo patients, Randy, are primarily those individuals who've had previous enhancement and have begun to encapsulate this process of this.
What does that mean, encapsulate? Oh, the hardening of the breast.
It's the hardening of the breast tissue, Randy. I mean, that's probably the #1 redo that we see. Secondary category from those particular individuals would be those that have had an enhancement for some period of time and are now ready for an additional procedure, be it removal of their old implants and a change to a new set of implants, or whether now they're in the market that they now need to consider some lifting of their existing breast tissue.
Okay. What about those women that went too big the first time and now they want to? Is that common?
It's very common. I think that, there was that pendulum swing that we talked a little bit about earlier where there was a lot of people getting very large implants, and gravity takes a huge toll on that heavy implant. Drag those breasts down towards the floor, and now they're in this position where they need to downsize the implant, and unfortunately the skin doesn't have those elastic properties to be able to shrink and accommodate to a smaller product. So now these individuals, Randy, are faced with the need for downsizing of the implant product in conjunction with some modification of the skin envelope. In other words, some lifting procedure.
Is earlier treatment then on that better than later?
Absolutely. I mean, the earlier...
For the breast augs that are sagging after 10 years or whatever.
The earlier, Randy, that people come to see us, the more elastic properties their skin retains, the more longevity and the more we're able to provide for those patients.
How long do breast implants last?
It's a very good question. The warranty information on implant products says the same thing on every one of them. It says this is not a lifetime product. It doesn't give people a very warm, fuzzy feeling about how long these things are going to last. There really is no lifespan on the implant. We know that statistically speaking, there's probably the need for people to change their product at some point in their life. It has a great deal to play.
Like 15 years, 20 years?
It could be 15, it could be 20 years. People can live with that product for a lifetime. It varies hugely, Randy.
What's the first sign, by the way? They start getting hard?
With a silicone product, there is no precursor to a loss of an implant. When someone has a silicone product, unless they have an imaging study that shows that that product has lost the integrity of the shell being the part of the implant that holds the gel together, they would have no idea that they've lost that integrity because you can't feel it and you can't see it. And it doesn't necessarily follow that people get hard when they lose the integrity of that implant shell. Most women that come to the office with the desire to change their implant have usually gone for a routine mammogram. That mammogram has shown that there's some signs consistent with a loss of the shell of the implant, and they come in consultation saying, where do I go from here? Can I keep what I have? Do I need to change to a new product? That's a very common scenario. But there's really no precursor. There's no, I got hard, therefore my implant must be ruptured, and I must need a new one.
So for those women that their breast implants are starting to get hard, what do you do? I mean, when they come back in, you've decided shape and size. Is it scar tissue? What's hard about it? The implant's not hard.
It's not the implant. It's the shell that our body makes around this implant. And this transcends both men and women. If I was to have a pacemaker put in, my body forms this natural shell around this pacemaker. It's our body's natural defense mechanism, Randy. It's scar tissue. And it's our defense mechanism for taking this foreign object and walling it off from the rest of us. And it's no different than the wall of scar tissue that our body makes around
So how do you get rid
an
of
implant. You have to remove it. So it involves getting back into the breast, removing the implant, removing that shell that's begun to either calcify or become a little bit thicker than we want it to be, and then replacing the implant product.
Okay. Now we are out of time. Okay. But Final message, somebody watching this, they're not happy with their breast.
If
What do you tell them?
if for any reason they're unhappy, whether they're too small or whether they're too droopy, whether they've experienced changes in the breast that they have, they owe it to themselves to come to the Cosmetic Surgery Institute in Palm Desert. Dr. Zachary, myself, we can give them a very comprehensive idea of what we have available to them to get them where they want to be.
What should they look for in a surgeon that's going to do any kind of breast surgery?
Track record means everything. I mean, they should know how many breast patients is that practice doing? How many breast patients is that particular surgeon doing?
Why is that important? I mean, obviously, the more you do, the better you become. Is that what it is?
It really is, Randy. I mean, I think that no matter what we do, whether it's breast surgery, whether it's face surgery, we learn something about what we're doing right and something about what we're doing wrong with every case.
Now, you've joined by far the busiest practice in the desert. So you'll get a lot more practice, I guess with this. But with looking for a surgeon that's doing breast, do you also believe they have to be board certified, plastic?
I think they have to be board certified and they have to demonstrate that they do good work. I think that
through their work.
Yeah, I think board certification in and of itself is not a given that they can provide exemplary surgery.
Great stuff. I want to thank you
very much, Randy, for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go to our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.